What do you do if your doctor can't seem to find out what's wrong with you? Well, thanks to my work for over 30 years as a keynote speaker, I've met some of the brightest people on the planet, especially when it comes to medicine. About 20 years ago, I attended a lecture regarding new technologies developed to protect the health of Russian cosmonauts living on the Mir space station, and was introduced to the one person in the country who was offering that technology. Her name is Pauline Rose, registered nurse with postgraduate training in neurosurgery, tropical medicine and environmental medicine. She's always at the forefront of medical developments, and since our first meeting has introduced me to amazing medical developments from Germany, USA and Russia. On a personal note, my wife and my best friend's wife were both treated by Pauline Rose for migraines and cancer respectively. In each case, within 6 months, my wife no longer suffered debilitating migraines nor needed to endure the side effects that came with earlier treatment. And the personal doctor of my friend's wife informed her that the cancer she had cleared up. Pauline Rose's approach to medicine is to treat the cause of a problem, not the symptom. Now, you might assume that this is what all medical therapy is about, but that would be incorrect. History is full of good people trying to improve the health of their fellow man, only to find they must battle entrenched interests protecting a status quo. But thankfully, some continue to pursue the greater good regardless, and Pauline Rose is one of those. So now, I invite you to consider the most advanced medical diagnostic technology that I've ever seen. It's cutting edge, pardon the pun, but no actual cuttings involved because it's completely non-invasive. Of course, anything as advanced as this needs an expert who knows how to drive it. So naturally, I visited her rooms in Sydney to find out more. Here I am at Pauline Rose's rooms, and Pauline, what do you do to manage health?
Well, Chris, I look at the body from a cellular function point of view. Unlike my medical colleagues who will divide the body nowadays up into specialities, we're looking at the total picture. We're looking at what's happening at cell function, which leads to organ function, which leads to total body function. We are a big orchestra in the body, and everything has to play in tune if we're going to be healthy. Where you get changes in the cell function, you're going to get the start of disease. Someone in the game has to be looking at the total picture. That's where we come in with this award-winning equipment that we've got now. This is used in Europe throughout, and in America and throughout hospitals. And this is the hospital-grade version. I've got 3 versions of this machine.
And it is award-winning. In fact, it was developed by the Russians, being produced by the Russians, and we here in the West are playing catch-up. So, Pauline, let's have a look at what you've got.
Right. Well, this is a client that I screened earlier, and the clients are attached to the computer with some sensors. There's no radiation involved. And we screen down through all these areas of the body. And I have a huge library. I can add a lot more in if I want to. But this particular person has a problem with the bowel. And we can tell that because the coloured scoring system shows us a black area here, which is a problem, but a lot of general bowel inflammation. And this lady has some immune problems anyway, so we're not surprised to see flare-ups here. But I can do more than that. I can come down into here. This is the villi of the bowel. We can come into the mucous membrane lining. That takes me to active immune cells in the bowel. And I can look at the biochemistry of that, and also, particularly in this case, what the infections are that this person has. So she has some bacterial infection in the bowel, and she has an imbalance of healthy bacteria. So we're going to screen a lot of sections against the immune cells and see what's happening. This is mitochondrial cell. So the energy in the bowel is quite low, and we can be clever enough to go down to the major molecules, even if we want to, that make your energy system work. So a huge amount of detail there. She has constant allergies, and she has a lot of inhaled allergies as well, and we can see here inflammation in the sinuses because of that. And by controlling all of these factors, you're going to get her health much better.
That's really fascinating, Pauline, and one thing I think that I've noted that perhaps the viewer hasn't is that it's totally non-invasive. There's nothing stuck into the body whatsoever. To get a complete scan, total of the body, to diagnose what's doing what, where.
Yes, it's extremely safe and it's quick and efficient. We can treat as we go as well, so if I see an area that is well out of balance and that the frequency is not working correctly, we do have a dosing laser, and that is non-invasive as well. It's just a frequency device, and we can correct the adverse frequency in the body. Now that doesn't correct the biochemistry and it doesn't kill the bacteria. We still have to do that, and the computer will give us a list of suggestions of the best way for that body and that bacteria to be treated.
I've seen you diagnose bacterial infection, but also fungal and viral infection.
Yes, viral infection is very common, and viruses mutate a lot, so we have to keep up to date, but because frequencies change a lot, we can do it very easily on here.
That's almost Star Trek.
Oh, it is Star. This is Star Trek is here. It's so exciting. I have a lot of long distance and country clients.
Okay.
Now, often they will come to me for the first visit. They'll make the effort to come to Sydney, and we'll run the scan, because I can't run the scan long distance. I have to have client in the chair attached with the sensors.
So if they come in here first...
Yes, they come in here first. I need a case history, I need all the details, I need to know what drugs they're on, I need to know all of this information, just as any other one person would. And then once we've got them set up initially, I can run them long distance after that.
So you're evaluated, first visit, but you can be living in Birdsville and be treated long distance afterwards.
After that, yeah. Because I have a different computer, which we're not talking about today.
We're not talking about
does all that.
That's
yes.
fascinating,
yes.
to say the least.
Yes.
Best thing to do is to look at the phone number here and Pauline's website and that information to follow up anything you may need to know about what we've just discussed. Thanks, Pauline. I know this is only a tiny fraction of what you actually do here, but my background, I'm just fascinated. It certainly helped my family and some close friends of ours, so thanks again. It's been really delightful.